Hi, everybody. I have a great resource for you that we're going to be talking about today. One of my favorite sites that has wonderful information is spinningbabies.com. This is the home page, and there are a lot of things that can cost money and that you can get education on, and it's wonderful. But there are also, if you go to blog and resources, there's so much that gives you great information. So today, what I specifically want to go over is some free tools. Okay, let me see right there. Free tools. So I was home, show you again. I was home, spinningbabies.com, pressed on blog and resources, scrolled down until I got to free tools. All right, they have daily pelvic floor exercises, which is wonderful. They have kick chart, keep a kick chart to note baby's movements, and birth collaboration with spinning babies, a conversation to your birth team, and that's wonderful. I'm going to click on that really quick. Well, let me go through this first. Labor checklist, techniques to help you during labor, and 3 ways to shorten labor, a guide to support pregnant people needing to be self-sufficient in labor. So there are some really great things that are right up my alley, but today we're going to be specifically talking about birth collaboration. Okay, so this is essentially a birth plan. And it starts off with, introducing yourself, your name, why you chose the setting you chose, what's so crucial for you. Um, then it also talks about your laboring preferences, your comfort measures, okay, like what you think is going to be best for you, how you get pain relief. And it has in case of surgical birth, immediate postpartum. So there are so many things about this document that are great. Absolutely love it. I think that it would be valuable for anybody to print this off, have it ready, put it in your bag, in case you have baby, have another copy in your car if you are not able to go home and get your hospital bag before you go to the hospital in labor. What I love about it is it sets things up in a very clear way, and it goes over very simple things that can really impact your birthing experience and make it better, make it really good. Now, criticisms that I have. Recent research has shown that um, when you have a birth plan, and most moms, by the way, that I see, I go through their chart review, and most do not. Like the vast majority do not have birthing plans. Um, Birthing plans can be great. It's a great way to communicate with nursing staff, especially if you talk to your physician first about your birthing plan and they share that with nursing staff. It can be a great way to give you the best birth possible. So, advocating for yourself before you even get to the hospital, because when you're in the hospital, it will be very stressful. Not very many people actually do it, not at least not at the hospital I'm at. Now, there is, though, and this is where I'm getting into the criticisms, there is some research that shows that mothers who do have these birth plans tend to have higher levels of just anxiety. And I don't mean clinical anxiety, I just mean the emotions, the feelings of anxiety. Um, a lot of times they do it because they're anxious about giving birth, which is a risk factor of developing postpartum PTSD. And after the fact, women who have very detailed birth plans tend to get, symptoms of postpartum PTSD more frequently than other women. So there has been this recommendation in the literature that rather than having a birth plan, you have a birth flow chart. So what I would love to see is this document to be turned into a flow chart. That would be wonderful. Maybe I should make that. We will see. We shall see. But what I do like is that it says in case of surgical birth. So it's letting moms know that's a possibility. And it also requires moms to think through that possibility and to communicate that with nursing staff before it even happens. So in that regard, it is following that spirit of a flow chart with that one area. So going forward, I would definitely recommend this. Just maybe keep in mind that you don't want to have anything like it's my way or the highway and it has to be exactly this, because when we visualize the way something's going to happen, and we get attached to it, and then it doesn't happen that way, it can be, a lot of grief. And that grief can make it can complicate an already complicated mental health situation. So my recommendation is that yes, do your version of a birth plan. Yes, you can even use this document. But if you want to do even better and give you the best odds of not developing postpartum PTSD, then do a flow chart. All right. Hope that was helpful. And I really hope you check out the website, spinningbabies.com. I think they have wonderful information and resources. Until next time, bye.